Imagine a patient comes to the emergency room, elderly, severely dehydrated, confused, and his blood sugar level is 900 mg per dl, but there is no significant ketones. Is this decay? Obviously not. This is not decay, but this is a condition known as hyperosmolar hyperglycemic state, or you can say it like as SSS. It's a life-threatening diabetic emergency with a mortality rate much higher than decay. Hello, this is Dr. Mukib, presenting you with a new video on SSS. So let's get started. So what is SSS? Hyperosmolar hyperglycemic state is a severe complication of diabetes mellitus characterized by 1. Extreme hyperglycemia. The sugar level will be much more than 500 mg per dl. Severe dehydration. There will be severe dehydration. The patient will be severely dehydrated, and the serum osmolality rate will be much more high. There is minimal or absent ketosis and no significant metabolic acidosis. So it's quite similar like decay, but in decay we get like ketosis and metabolic acidosis. In SSS there is no ketosis and no metabolic acidosis, and it is commonly occurs in elderly patients, type 2 diabetes mellitus, I mean patients with type 2 diabetes mellitus, and patients with infection or poor fluid intake. Now the risk factors or the precipitating factors, the precipitating causes for hyperosmolar hyperglycemic state. So the common triggers are: 1 is infections like pneumonia, urinary tract infection, sepsis, etc., etc. 2 is like myocardial infection. This is also one of the most common trigger factor. 3rd one is stroke, any kind of stroke like severe hemorrhagic or ischemic whatsoever. The 4th one is like poor compliance with insulin. 5th one, most common, in undiagnosed diabetes patient. And the 6th one is drugs. Drugs means some drugs that causes hyperglycemia, that is steroid, thiazide diuretics, and antipsychotics. So these are the common trigger factors or precipitating factors that causes SSS. And in elderly patients, decreased thirst mechanism, and actually in elderly patient the thirst mechanism is slowly decrease day by day. So this decreasing thirst mechanism in elderly patient worsens dehydration due to lack of fluid intake. So let's understand the pathophysiology of hyperosmolar hyperglycemic state, and we will understand it step by step. The first one is relative insulin deficiency. In SSS, there is enough insulin to prevent ketosis, but that insulin is not enough to prevent hyperglycemia. The second step is severe hyperglycemia. Blood glucose level is often more than 500 to 600 mg per dl. The third one, osmotic diuresis. As there is high glucose level in the blood, that spills into urine, and that pulls water and electrolytes, and that cause massive fluid loss due to osmosis. And the fourth step is severe dehydration. As there will be more urination due to osmotic diuresis, the patient may lose around 8 to 12 liters of water. And the last one, the 5th step is increased serum osmolality. Normally, the normal serum osmolality is like 275 to 295 milliosmol per kg. But in SSS, it will increase to more than 320 milliosmol per kg. So high osmolality causes altered mental status, confusion, and may lead to coma. Let's discuss with the diagnostic criteria for SSS. So according to American Diabetic Association, to diagnose or to confirm hyperosmolar hyperglycemic state in a patient, the plasma glucose level should be more than 600 mg per dl, along with serum osmolality should be more than 320 milliosmol per kg. There should be the pH should be more than 7.30 with bicarbonate level more than 18 milliequal per liter. There will be small or no ketone bodies. There will be minimal or there is no absent ketone bodies, and there should be altered mental status of the patient. Now the fact is that we can find the glucose level, pH level, bicarbonate level, everything by doing lab investigations. So what about the osmolality level? How can we calculate it? So there is a formula. So the formula to find out the serum osmolality is to multiply the sodium level of the patient plus the glucose level of the patient divided by 18. So this will give you the serum osmolality level of the patient, and if it is more than 320 milligram 320 milliosmol per kg, that qualifies the patient to diagnose as a SSS. Now, what are the signs and symptoms? I mean, what are the clinical features of hyperosmolar hyperglycemic state? So first of all, I'll talk about the symptoms. So there will be polyuria, like decay. There will be polydipsia, again it will be like decay. There will be extreme weakness, dry mouth, and weight loss. These are the symptoms of SSS. And what are the signs? The signs for SSS, hyperosmolar hyperglycemic state, are: 1. The severe dehydration. There will be tachycardia associated with hypotension, and there will be altered sensorium. And in severe cases of SSS, there may be seizures. The management for hyperosmolar hyperglycemic state is quite similar to diabetic ketoacidosis. Then also, I'll discuss about it. Like first and foremost, the first priority to be given to a SS patient is fluid resuscitation. Do not never ever give insulin therapy first. So for fluid resuscitation, start immediately with normal saline, that is 0.9% normal saline, 1 liter or 1.1 to 1.5 liter over the first hour. Then the infusion rate should be adjusted based on the sodium level. The total deficit is like 8 to 12 liters in a SSS patient, and we should correct it gradually over 24 hours. We cannot correct it rapidly, because it may cause like cerebral edema. And second line of management to control SSS is insulin therapy. First of all, we have to do resuscitation, then we have to go for insulin therapy. So after starting IV fluids, so IV regular insulin, that means like regular insulin is like human ectopy, we can use like 0.1 unit per kg bolus, optional. This is optional, we can give it like bolus dose. And after that, we have to go for infusion, slow infusion, like 0.1 unit per kg per hour infusion. And the target to reduce glucose is by 50 to 75 milligram per hour. We cannot reduce the glucose level all of a sudden. We have to reduce the glucose level step by step, gradually. So when glucose level reaches by 300 milligram per dl, we have to add 5% of dextrose, and we have to reduce insulin infusion. So next, the third step for management of SSS is potassium management. Check the potassium before insulin. We have to check the potassium level, and also we have to do ECG to find out if there is any tall T wave or white QRS which is suspected of hyperkalemia. We have to correct accordingly. So we have to check potassium before insulin. If the potassium is less than 3.3, we have to correct it first by adding or by start the infusion of injection potassium chloride. And in a different video, I'll talk about injection potassium chloride, how to administer it to a patient. So if the potassium level is 3.3 to 5.3, is in between 3.3 to 5.3, we can add potassium in IV fluids only. And if the potassium level is more than 5.3, patient is like hyperkalemic. So we have to monitor closely. So the fourth line of treatment for SS is treat the underlying causes. So like start antibiotics if the infection is suspected. If you are suspecting that the patient is having SSS just because of any infection like pneumonia, sepsis, UTI, whatsoever, start antibiotic. Do not wait for any cultural sensitivity. And if you are suspecting like MI, if there is ECG finding in MI, ECG findings of MI, so start the treatment line of MI. Or if there is stroke, because there is signs of stroke, or if there is evidence of stroke in CT scans, we have to manage accordingly in that way. And we have to stop certain drugs that precipitate SSS, like steroids and thiazides. Let's talk about the complications of SSS. So the first complication, which is very rare but fatal, is cerebral edema. The second most complication is hypoglycemia. So we have to monitor the sugar level after starting insulin infusion every 1 hourly. And the third most complications of SSS is hypokalemia. Due to excessive fluid resuscitation, the patient may suffer of hypokalemia. The fourth complication of SSS is acute respiratory distress syndrome due to fluid overload that will cause pulmonary edema. And the last complications of SSS is thromboembolism. And remember one more thing, the mortality rate in SSS is 10 to 20% higher than decay. So SSS is much more dangerous than decay, remember. Now we'll have a quick comparison between SSS and decay. The glucose level in SSS will be more than 600 mg per dl, but in decay it will be more than 250 mg per dl. And about ketone bodies, there will be minimal or no ketone bodies in hyperosmolar hyperglycemic state, but it will be definitely present in diabetic ketoacidosis. And what about acidosis? Acidosis is absent in SSS, but it should be present in diabetic ketoacidosis. That's why decay is called as acidosis, diabetic ketoacidosis. And about osmolality is very high. That's why the SSS got the name hyperosmolar hyperglycemic state. And in decay, it just slightly increased, but there is no much more osmolality seen in that patient in decay. And the mortality rate is much more higher in SSS than decay. So let's discuss about how to prevent SSS. So to prevent SSS, we have to educate the patients about to control the diabetes, about to keep hydrated. There should be adequate hydration. There should be regular glucose monitoring. There should be sick day rules. There should be early treatment of infection. If there is any infection in a diabetic patient, the infection should be treated early, and there should be proper medication adherence. Let's talk about the conclusion of the topic. Hyperosmolar hyperglycemic state is a medical emergency with high mortality, especially in elderly patients. Early recognition, aggressive fluid resuscitation, careful insulin therapy, and electrolyte correction are the keys to save life in SSS. Remember, in SSS, fluids come first, then insulin. So this is the end of the topic. I hope you found the video helpful. Kindly do me a favor by like, share and subscribe to this channel for more simplified medical discussions. Comment below if you want a detailed comparison between decay versus SSS. Thank you.